everyone, this is Dr. Alvarez here at Smile Squad in Las Vegas, Nevada, and I wanted to touch upon a very important question I get, which is what toothbrush should I be using for my child? And we have a variety of toothbrushes that are available, but I wanted to touch upon a couple of them, and it's really based on age, and I'll go into each one of them. But at the end of the day, the most important thing is that you want your child to brush 2 times a day and to start flossing when they're around 3 to 4 years old, when their teeth start touching and when they have contact. And if you're doing these things, you're doing the right things. But we have toothbrushes that are a little bit fancier, and I'll go into each one of them. But we have this really cool banana toothbrush that infants can use, and usually the recommendation for these is around infant to 18 months of age. And they're really cool because they're silicone based and they allow your baby to bite on them in case they're teething. This can help out a lot. And the cool thing is that it's silicone and it's really soft, and it allows the baby to bite on it without injuring. And it's actually really cool because if they're teething, this can actually help with the teething process, and it's really cute, and they can hold on to it while they're playing with it. And the second one is this Frida toothbrush, and it's basically has 3 heads to it, so you just have to do 1 pass on the teeth, and then it cleans all sides of the teeth that you're working on that side. There's many other toothbrushes that have either 2 heads or 3 heads, and the awesome thing about this is that when you're brushing that one side, and I'll show you on this model, is that you get all the teeth and all the angles at 1 pass, right? So you're brushing the top and the sides on each side here, and this is a bigger mouth. It's not necessarily baby teeth, but you can see that if you do 1 pass, you get all surfaces of the teeth. So it's really cool. So again, it has 3 heads on it, and this is really cool because sometimes with kids, they might not want to brush the full 2 minutes, so this helps out a lot. And the other ones are your Winnie the Pooh toothbrushes, and then we have your Mickey Mouse toothbrushes. And the important thing to consider when looking at toothbrushes is that the bristles are soft. And you can see that this is soft bristles, and when you're choosing a toothbrush, make sure that if you're choosing bristles that it's going to be soft or extra soft. You never want to choose hard because it's going to be abrasive on the teeth and the gums, and this can cause bleeding and you can damage them. So you can see that it has a broader head, so you can get more surface area from this toothbrush. And again, this is from infant to 2 years of age. When you're brushing, make sure that with these, because they're only 1 head, that you're brushing the top surface and each side, and you want to be brushing in circular motions in where the gum and the tooth meet, and then on the biting surfaces you can go back and forth. So again, circular motions where the gums and the teeth meet, and then back and forth on those biting surfaces. And then we have these also, which are a little bit bigger, the heads and the bristles. So this would be around 4 to 8 years of age. So it's a little bit bigger. Their hands are a little bit bigger so they can grab onto it. And you can see that it's really soft bristles again. And it's very similar to the other toothbrushes that I mentioned with the soft bristles. But again, it gets a little bit narrower, and it allows for more dexterity and also to get all angles of the tooth, because now you have teeth that are different shapes and sizes. So you have the front ones, and then you have the back one. So you can see that there's a little curvature here with these purple bristles, and then the white ones. The last one, of course, is the electronic toothbrush. And electronic toothbrushes are great because they allow kids to interact, and some of them have timers on them. Some you can connect to cell phones and put them on Bluetooth, so you can track how often they're brushing and if they're doing a good job on certain areas. So they're very interactive and very good tools for patients. And usually you want to be brushing a minimum of 2 minutes, and it allows you to brush 30 seconds on each quad. And with kids who have braces, these are also really cool because it cleans a little bit better.